As we age, our bodies go through many changes. Some are easy to accept, like a few more wrinkles or gray hair. But when it comes to intimacy and sexual health, the changes can feel more personal, even unsettling. Many older adults in America silently wonder if a healthy sex life is still possible after 60, 70, or even 80. The truth is, aging does affect our sexual health, but it doesn't mean intimacy has to fade away. Hormones shift, bodies respond differently, and sometimes health conditions or medications make intimacy more challenging. Yet, many couples find that with openness, patience, and the right support, physical connection can remain a meaningful and joyful part of life. In this talk, we'll explore how aging impacts sexual health, what changes are normal, and how seniors can embrace intimacy in new and fulfilling ways. Because growing older doesn't mean giving up on love or pleasure. For many men, the changes in sexual health that come with aging can feel confusing or even discouraging. After the age of 50, testosterone levels naturally decline. This can lower sexual desire and energy, but it doesn't mean the end of intimacy. Erections may take longer to achieve, may not be as firm as before, and sometimes are harder to maintain. This is not a sign of failure, it is simply how the body adapts with age. The time between one sexual experience and the next, often called the recovery period, also tends to lengthen. Some men notice changes in ejaculation, such as less semen volume or less intense orgasms. These changes are normal and happen gradually. What matters is not to see them as the end of a fulfilling sex life, but as an invitation to explore intimacy in different, often deeper ways. Remember, intimacy is not only about performance, but about connection, trust, and shared joy. Aging may change the body, but it doesn't have to dim the flame of closeness. For women, the journey of aging brings its own unique changes in sexual health. One of the most significant transitions is menopause, when estrogen levels drop sharply. This natural shift often leads to vaginal dryness, thinning of tissues, and less elasticity, which can make intimacy physically uncomfortable if not addressed. Orgasms may also feel different. They might be shorter, less intense, or take longer to achieve. While these changes can feel discouraging, they are part of the body's natural rhythm. Many women, with the right care and communication, continue to experience satisfying intimacy well into their 70s and beyond. Emotionally, some women may feel a decline in desire, especially if they struggle with self-image or health concerns. But others discover a new sense of freedom, no longer worrying about pregnancy. They can focus on pleasure and closeness without fear. It's important to know that support exists. Simple solutions like lubricants, moisturizers, or hormone therapy can make a profound difference. More importantly, open conversations with a partner help replace worry with understanding and discomfort with compassion. Aging does not close the door on intimacy. For many women, it can open a new chapter, one where connection is deeper, sex is more intentional, and pleasure is rediscovered in surprising ways. Beyond the specific changes that men and women experience, there are several common factors that affect sexual health in later life. These influences often go unnoticed, but they can make a big difference in how intimacy feels and how relationships thrive. Physical health is one of the biggest influences. Conditions like heart disease, diabetes, arthritis, or chronic pain can limit energy and comfort during intimacy. Medications, while essential for managing these conditions, may also reduce desire or affect sexual function. For example, blood pressure medicines or antidepressants are well known for causing side effects in this area. Mental and emotional health also play a vital role. Stress, grief from losing a partner, or anxiety about body image can lower sexual confidence. On the other hand, feeling valued, safe, and emotionally connected can reignite intimacy even when the body changes. Lifestyle choices matter too. Regular exercise, a balanced diet, quality sleep, and avoiding smoking or excessive alcohol not only improve overall health but also enhance sexual well-being. Ultimately, sexual health in later life is shaped by a mix of body, mind, and lifestyle. When seniors take a holistic approach caring for their health, emotions, and relationships, they often find that intimacy remains not only possible, but deeply rewarding. Maintaining a healthy sex life in later years is about much more than physical pleasure. It is about overall well-being. Studies show that seniors who remain sexually active often report better physical health, stronger emotional resilience, and deeper satisfaction in life. Physically, sexual activity boosts circulation, strengthens the heart, and even supports immune function. The release of endorphins during intimacy can ease pain, lower stress, and promote better sleep benefits that are especially important as we age. Emotionally, intimacy helps reduce feelings of loneliness and isolation, which are common challenges among older adults in America. Sharing physical closeness builds trust, comfort, and a sense of belonging, powerful antidotes to depression or anxiety. For couples, maintaining intimacy strengthens relationships. It keeps communication open, nurtures affection, and creates joy that goes beyond the bedroom. For individuals, it can boost self-esteem, body confidence, and the belief that love and desire are timeless. In short, a healthy sex life is not a luxury, it is part of healthy aging. Embracing intimacy can add vitality, meaning, and happiness to the later chapters of life. While aging brings natural changes, there are many solutions to support a healthy and satisfying sex life. The key is to approach intimacy with openness, creativity, and a willingness to adapt. Lifestyle choices are the foundation. Regular exercise improves circulation, boosts energy, and enhances confidence. Eating a balanced diet rich in fruits, vegetables, and lean protein supports hormone health. Prioritizing quality sleep and stress management also keeps desire alive. Medical support is another important option. Men experiencing erectile difficulties may benefit from medications like Viagra or Cialis. Women dealing with dryness or discomfort can use lubricants, moisturizers, or consider hormone replacement therapy with medical guidance. These solutions can make intimacy more comfortable and enjoyable. Emotional connection is equally vital. Honest conversations with a partner about needs, fears, and expectations replace frustration with understanding. Exploring intimacy beyond intercourse through touch, affection, and companionship keeps love strong and meaningful. Finally, never hesitate to seek professional guidance. Doctors, therapists, and support groups can provide tools and reassurance. Intimacy in later life is not about recreating youth, but about discovering new ways to feel close, connected, and alive. Growing older is a journey filled with wisdom, memories, and new perspectives. Yes, the body changes with age, hormones shift, energy levels fluctuate, and intimacy may look different than it once did. But these changes do not signal the end of a fulfilling sexual life. Instead, they open the door to a deeper, more intentional experience of love and connection. Intimacy in later life is not about chasing youth, it is about embracing the present moment. It is about holding hands, sharing laughter, exploring closeness, and finding joy in both the small and profound moments of connection. Sexual health at its core is part of overall health, and caring for it brings vitality to body, mind, and spirit. For seniors in America and around the world, the message is clear. Intimacy does not have an expiration date. With open communication, healthy lifestyle choices, medical support when needed, and above all, compassion for oneself and one's partner, love can remain vibrant at any age. Aging is not the end of intimacy, it is simply a new chapter. And like every chapter in life, it holds the potential for growth, discovery, and joy.